Well, last night, our FactCheck team revealed the shocking extent of England's missing nurses in neonatal and critical care. Tonight, we can show you just how bad things are in maternity units up and down the country. Our exclusive data, which we obtained after a 10-month battle with NHS England, shows how many nurses and midwives are missing from maternity wards. Here's how it works. NHS maternity wards calculate or plan how many nurses and midwives should be on wards based on the number of patients, mums and babies they usually have and how complicated they expect the births to be or sick the patients are. And from this, we'll get the so-called fill rate. Now, let's imagine that this system says you should plan to have 10 nurses or midwives on shift, but on a given day there are only 9 available. That means the ward is missing 1 in 10 or 10% of their planned nurses and midwives. Now, we found that half of hospitals in England are consistently in this situation in their maternity services, and we can reveal that 1 in 8 English hospitals are missing even more than that. 2 in 10, they are 20% short of planned nurses and midwives. And by the way, these stats don't include other types of care staff. But with this data, we can now pinpoint individual hospitals where maternity services are particularly short of planned nurses and midwives. At 2 hospitals run by North Cumbria Trust, 30% of planned nurses and midwives were missing from maternity services. All our figures are averages across January 2023 to November 2024. The trust in charge of these hospitals told us their staffing rates have improved since then and they're hiring more. Let's go on to some more. At Basildon Hospital in Essex, the gap is even larger, with 31% of nurses and midwives missing. And at John Radcliffe Hospital in Oxford, they're missing 33% of planned for nurses and midwives. Now, trusts running these hospitals told us they have robust processes to monitor staffing levels on at least a daily basis to ensure they are suitable for the number of occupied beds and the care needs of patients. And NHS England said the number of nurses and midwives working in the health service has reached its highest ever level, but it said there was more to do. Krishnan.
So what impact are those staffing pressures having on the care women receive when they give birth in hospital? Jane Death spoke to 2 mothers about their experience.
Oh, where did it go?
Beatrice Scudler gave birth to Marianne at Oxford's John Radcliffe Hospital, a busy maternity service, which our data shows had the highest shortfall in planned midwives and nurses. Beatrice was well cared for by midwives during labour, but because she hemorrhaged and needed surgery, she was moved to a postnatal observation ward, where she says she was only seen by 2 nurses who seemed overstretched.
One of the 2 nurses came and told me to stop crying because I was bothering everyone in the room. I was delirious, I was exhausted, I had lost so much blood, and instead of support, I was essentially shouted at and told to stop crying, and the nurse just left. At first I was panicking, but then it goes from panic and fear to pretty much despair. I felt completely alone, I felt completely abandoned.
The ward was 20% short of planned midwives and nurses that day. Oxford University Hospital's NHS Trust said it was very sorry to hear about Beatrice's experience. It said since 2023 it's invested more than £1 million a year in midwifery, recruiting 54 midwives. When Rachel Coles went into Queen's Hospital in Romford in 2021, the labour ward was fully staffed, but so busy there was no midwife free to induce her. She waited 14 hours.
They couldn't get me to labour ward, although my contractions they were 7 minutes apart at that point, but I'd been contracting for 24 hours.
By the time Rachel gave birth to Dougie, she'd been in labour 54 hours, which she believes caused a hemorrhage in which she lost massive amounts of blood.
They are too busy, they're too rushed, and it is causing too many problems. And my birth should not have happened in the way it did.
The NHS Trust, Barking, Havering and Redbridge said the hospital had been exceptionally busy with women needing high-level support, but it's sorry Rachel had a poor experience. The Royal College of Midwives says we're losing people because the pressure is too much.
We did a survey last year on just 1 week. We asked midwives how many extra hours they were doing, and it was 118,000 hours extra that they were doing. And to us that shows the hidden number of shortages, because actually if you're going without breaks, you're working extra hours just to give the basic care. It shows you that the number of midwives isn't right.
The senior midwife who's led reviews into maternity scandals, Donna Ockenden, says the midwife shortages the programme has revealed are alarming.
Clearly they're of significant concern, very significant concern. We know that where units are understaffed, that there is an increase in patient safety incidences. Reports have shown that can also translate into an increase in deaths.
The pressure in maternity units is being felt by mothers and midwives who say everyone deserves more help.